Yes, before giving anything like a conclusion, actually the idea was that the conclusion would be before the questions and the answers, and I think we do not have that much time anymore. But I would first try to give you a view on Europeans for Safe Connections. We are an umbrella association here in Europe. We are very conscious of the EMF risk and specific attention to electro-hypersensitivity or electrosensitivity, as it is called sometimes. We were founded in 2023, and we have altogether about 10,000 people in our membership. And then I do not count the Facebook groups and other social groups, because they never know how much participants they actually have. We have the intention to promote protection of humans, flora and fauna, and actually we have some focus, of course, on humans, as we have today. And we want to educate and promote general understanding of the risk of electromagnetic fields, and we pursue better regulation. And all this is based, as far as we can, on the scientific knowledge on the field, whether it's already proven or strong science to it. As we have seen also today, there is a lot of knowledge on the effect of EMFs and the digitalization. And a lot of research still needs to be done, but the knowledge is sufficiently available. So that's what we promote. We are not only have members in the European Union, but also we have members outside the European Union. We would like to thank the presenters, Dr. Pillai, Dr. Belpoggi, and Dr. Michaelidou. We very much appreciated the presentations you gave, and it gave a lot of interesting information and also important information. And when I add up all the information that is given, I have the tendency to say that there are 4 important perspectives of the impact of digitalization on society and children and adolescents especially. I would say it's about human behavior and social life. It was about digitalization and brain development. And it was the distinction between the real world and the virtual world. And of course, a lot of information on the impacts of EMFs. But we also are we very much like the practical approaches that are possible to improve the way we at this point in time use the digital age. And about the human behavior and social life, gradually in society it is becoming understood that digital devices somehow have an impact on human behavior and social life, but also influence the way people appreciate one another and how they appreciate all kinds of situations they face. And Dr. Pillai clarified that the way our brain works and how it develops when we grow up creates a large variety of unexpected and unacceptable results. He clearly showed that due to the fact that a healthy brain of a child is not in a position to resist all incentives and social media produce. Therefore, they keep on looking and scrolling their devices for many, many hours each day. And about digitalization and brain development, Dr. Michaelidou focused at the very young ones, babies and toddlers, and they need to first encounter the real world before they are fit to participate in the virtual reality. If schools and parents don't create a good setting for these children to develop, the healthy development of their brain is hampered. And this is in line with the knowledge that Dr. Pillai presented this afternoon. And about a proper distinction between the real world and the virtual world, we also heard interesting notions. Various impacts of social media in children were mentioned. Sexting, game distortion, addiction, hate, bullying. And important arguments were shown to wait with smartphone until 8 or 14, maybe even up to 16 years old, as apparently is required at the other side of the world in Australia. It was shown that the Australian government is not walking on thin ice when they require 16 years. Sufficient scientific base for this exists. And children need to first feel objects with their own hands or their mouth. They need to see the movements of things, experience resistance and restrictions. They need to smell, to play, physical exercises with their peers, and in doing so, learn to become a well-balanced individual with all social skills that are required. And then about the impacts of EMFs, which is actually the core issue of our association. And in this webinar, it was shown that there are serious issues with the EMFs themselves, although a lot of authorities are not really aware of this. It is denied by them, but the science directs us at harm for all living beings, including humans. And Dr. Belpoggi presented the outcome of the research of the Italian Ramazzini Institute on the impact of EMFs on rats, and also in comparison to a similar study with the National Toxicology Program in the US. And this shows that EMFs can lead to cancer. And as these animals are used to predict health risks for people, normally, authorities need to change their paradigm that only heating of EMFs would be an issue. Another study showed reproduction problems for men and possibly for women as well. At the same time, we are aware of reduced fertility of men and lots of couples asking medical support to have a child. In the press, they never talk about the cause, but here we see an important cause for infertility of couples. But when we look at the very young ones, the vulnerability is even bigger than for adults. The brain development can be disturbed even before even before birth. We all know babies and toddlers have a relatively big head. They need we all need our brain to learn. And science shows that EMFs interfere with the brain of children even more than with adults. So they need protection from these waves. Do we by now see any concern about the digitalization in society? The figures Dr. Belpoggi showed suggest we are at the beginning that people start to see some of the problems, not necessarily with EMFs, but certainly with digitalization. Yesterday we heard on the news here in the Netherlands that school children are not only bullied through social media, but also threatened and even extorted by other youngsters and forced to cry out their misconduct while being filmed, which is shown later to other kids who start bullying. It is a next step of the negative side effects of digitalization, making in schools, the police and parents aware that action is needed. But so far, the blame is at the extorting youngster, and the solution is only advice on how to use digital media and when to call for help. So far, we do not yet see in the news a relation with age-dependent use of digital media, but most schools in my country have banned smartphones based on a formal advice from the government. So how can we improve? Many good possibilities were given in this webinar for improvements. Ways to reduce EMS, reduce the impact of the devices, use them for education only when it has been proven beneficial, respect the human rights of children for a healthy environment, and encourage healthier alternatives. In some countries, governments are starting to promote measures or even require to ban smartphones from schools, and support of such measures by citizens is important to make them effective. It is very difficult for an individual child not to have a smartphone when all friends use them. The only way to prevent children from becoming a dropout is for parents to come together and take a mutual approach. We see such initiatives from the UK also applied in other countries. The experience in my country is that children initially oppose banning of smartphones, as we have seen from the presentation from Dr. Belpoggi. But once it is done, they learn the advantages of normal social relations. After a short time, they appreciate the improvements they experience. Thank you very much for your attention.